Kazakhstan has responded to the second year of the global pandemic with a strong vaccination campaign. Nearly 14 million vaccine doses have been administered in the country with a population of 19 million people. As schools and universities have reopened and many companies are returning to offices, are we nearing normalcy? I will meet with the World Health Organization representative in Kazakhstan, Ms. Clarinval, to make sense of the long and exhausting battle with COVID-19. Ms. Clarinval, thank you so much for taking time from your busy schedule to sit down with me. During our last interview in the summer of 2020, we were at a point in history when the global pandemic put the national healthcare system to its knees and really crippled the country's economy. However, today, vaccination offers hope that we may be nearing a return to normal. How far are we in our battle with COVID-19?
Thank you for your question. Thank you for having me today. So when we look back at the beginning of the outbreak, we were a bit at a loss, not knowing very well how to handle this disease, what are the particularities of the disease, but we've learned a lot. The governments have learned a lot on how they can protect their populations better. WHO has learned a lot in terms of what are the tools that we have available to guide these governments through the response of this disease outbreak. And I think the people have learned a lot on how to change their behaviors. People have started wearing their masks there and have learned about physical distancing. They wash their hands. There's one important tool that has come into that equation, which is vaccination. So ever since the beginning of the disease outbreak, scientists have been developing vaccines, and we could see that very quickly WHO has made also a big effort, as well as the international community, to roll out those vaccines. As well, Kazakhstan has been rolling out their own vaccine program very quickly and made those vaccines available to their populations. So people at the beginning were a little bit hesitant, right? But we can see now that the numbers are climbing across the region in Europe, as well as in Kazakhstan. So vaccination is one of the key tools that help us beat this current outbreak, but it's not the only one. So what we can sense often is that when people have been vaccinated, sometimes they might drop the precautionary measures. And my message to you would be to maintain them, but yes, please do get vaccinated.
Ms. Clarinval, you've just mentioned that Kazakhstan rolled out a vigorous vaccination campaign this year, and now with nearly 40% of the population inoculated, how close are we to herd immunity?
So we're not close to herd immunity yet, and that is the case in many other countries, as well as many other countries across the European region. But I believe that the effort that has been made by the government, and particularly the Minister of Health, in order to provide a diverse range of vaccines to the population, to make sure that the healthcare workers have access and are well trained in order to administer the vaccines, to ensure that the population is aware where to get vaccinated. So all that is a colossal effort. And Kazakhstan has been responding very quickly to this and made the vaccine available to its population. Now it's for the population to move ahead and to continue with getting the vaccines when and where available. And we encourage every Kazakh to get vaccinated where they can.
Ms. Clarinval, anti-vaccine sentiments have been somewhat a disruption to inoculation campaigns, and people have been reluctant to get vaccinated, especially during the early stages of the campaign. And there are many misconceptions and misinformation around COVID-19 vaccines. How do we address some of the concerns and fears around vaccination?
So I think there was a lot of misinformation. There still is a lot of misinformation. There's a lot of disbelief. And I understand that because we are confronted with an abundance of information. It's very difficult to triage what is right from what is wrong. And I think what is important is that people are aware where to look for the appropriate information. So the Ministry of Health and the government of Kazakhstan have made available much of the information that is available online. These websites can easily be consulted. WHO has very quickly also provided all the information. There is information available in Russian. And more particularly, WHO has also developed what we call Open WHO, which is a website where all of the a bit more scientific evidence is made available in a number of countries. What we have done as well at the country office is to make an effort to take that those standards and those guidelines, to translate them into Russian and many of them into Kazakh as well. So I think it's important that the information is the appropriate information is made available, but that it's also made available in Russian and in Kazakh, and that it is disseminated to the people, so that people can make an informed decision as to what it is that they ought to do.
But why do you think some of the misbeliefs are a lot easier spread than the actually evidence-based information that there's plenty online?
It's a good question. I think sometimes we just have a tendency to not necessarily question things. Many of the issues related to COVID-19 are in the end highly technical and rather complicated, and they do require a lot of background knowledge or the interest of trying to learn and understand how to interpret this information. It is a complex disease, so we all of a sudden have new varieties of the virus that start circulating. That can spur a lot of fear, because some of those might have no effect on the severity of the disease, on how the disease is being spread. But depending on some of the mutations, sometimes they have an effect on the severity of the disease or the speed at which it can be transmitted. What I think is important is that people are aware that WHO, with the member states and the scientific community, puts an enormous amount of effort in trying to understand, okay, what kind of variety do we have to deal with now? How does that virus behave now? And that's why I think all the efforts that are being made by the governments, trying to understand the epidemiological situation of, okay, where is the virus? How quickly does it spread from one person to the other? Are these people falling more or less ill? Are the vaccines working against those variants? Is fundamental. But that is complicated information. It's information that is evolving, so there's a high risk of misinformation circulating. I think one of the means to address misinformation is to simply put the accurate information out there the moment it is available, and to continue with that effort. And I think then at some point people will learn more, they will understand better, they will eventually be less afraid, and they will adjust to how to live in a life during a pandemic.
Ms. Clarinval, you've just mentioned that vaccine is an effective tool in fighting with the pandemic, however, not the only tool. And WHO is looking into a progress made in the treatment of COVID-19. What are some of the promising areas and promising drugs that the organization is looking at?
That is a very important area of work. So I think I'd like to welcome the effort that the scientific community is doing in order to find new treatments. I think it's also important that we understand that much of the current treatment protocols that are out there, they are working. So we know how to take care of the patients. We have to remember that most of the patients are mild or moderate cases, and they can be treated at home. They have to be monitored, but can be treated at home. What is important is that we need to particularly look after the severely and the critically ill who require essentially oxygen, additional oxygen supplies, or at worst case, mechanical ventilation. So for us, or for health systems to make sure that those patients are being taken care of, the health system needs to be strengthened. And we could see that Kazakhstan has made a big effort, they've built brand new hospitals, have made sure that all that equipment is made available, they've made sure that the healthcare workers are trained, and they've made sure that at the moment there is sufficient bed capacity in the intensive care units available to look after the critically ill. So what I want to say here is that there's a lot that we have learned on how to take care of our patients in order to decrease the mortality rate. Okay. Now there's a lot of research that is going on in order to develop new treatments. I think one key message here is that all that research is welcome. And I think it's a very laudable effort from the international community.
Despite the enormous efforts taken by the government to tackle the consequences of the pandemic and to stop the spread of the virus, still this summer we saw some of the highest COVID-19 case numbers. We've seen a daily increase peaking at more than 8,000 cases. Why did we still see such a rise in cases?
So over the summer, we saw an increase in cases. Very closely, where we're analyzing the epidemiological situation of those cases and trying to understand where they are and trying to correlate where they are, so know the bed capacities would suffice. And in the end, there was always enough hospital capacity available, there were enough doctors available, there were enough there was enough oxygen available, etc., in order to take care of the critically ill. And I think that is a laudable effort. So yes, we understand that this is a disease that is being transmitted from person to person, depending on how people behave, or depending on what the environment is, or maybe depending on what kind of variant we're dealing with, if that is one that is transmitted a bit faster or at a higher rate than others, then obviously we have to adjust our behavior. And the government has continuously issued and adjusted the public health and social measures. Your president frequently spoke to the nation and informed them as well. The minister was regularly in the media updating the population. So I believe that the information was made available, the system was able to cope despite this peak. So now we can see that the cases are going down again, which is very welcome. And the more people will be vaccinated, the more we will be able to keep this disease at a certain level and to be able to manage it and to manage the people that are sick.
And how has the WHO country office been assisting the health ministry or the government here in Kazakhstan?
So initially we were a very small team. So we have increased our capacities quite a bit, and we have mobilized technical expertise in a number of areas. For example, we have experts in infection prevention control, experts in case management, meaning that what are the protocols that must be made available to treat the patients appropriately. We have experts in risk communication, we have experts in laboratories, we have experts in logistics and supplies, and a number of other people that we flew in from the regional office or from headquarters. But at the same time, so WHO could only do a small part, but we were collaborating very closely with the Ministry of Health and the government of Kazakhstan, who were doing the heavy lifting. So we were just sharing the knowledge that WHO was producing at global and at regional level. We were translating it, we were training doctors and nurses on best practices. So for us, it was essentially a focus on knowledge transfer in order to make sure that the Kazakh healthcare workforce has access to the up-to-date information in order to take care of the patients appropriately.
Now this year we're seeing a revival of international travel. We're also seeing an increased and returned confidence and optimism among vaccinated travelers. And Kazakhstan has recently opened up its borders for 30 more countries with favorable epidemiological conditions. How timely are these steps?
So I believe that these steps are very welcome. It is important that populations can move and travel again. It's also important that they do it in a safe environment. More importantly, people that have an underlying medical condition or that are sick or that might be at additional risk if they travel, they might want to refrain from it or postpone it to a certain moment where for them travel is safe again. Overall, WHO does not necessarily insist on travelers being vaccinated or even on the vaccination passports. Governments initiate those different measures. Everyone does it a bit in their own formal way, which is an individual decision of a government, and it is in the end fine. But I think it's important that we just make sure that when travel starts, that we are able to continue to monitor the epidemiological situation in the country where those passengers then arrive. And just to make sure that the health systems, wherever it is that we are capable and able to treat patients, and that there's not all of a sudden a surge in numbers of cases that would affect that health system particularly. So it's something that we need to observe. I think we need to remain vigilant as well, but at the same time, I think it's a very welcome measure that we start opening travel opportunities again.
Now, schools have reopened in Kazakhstan. Universities have fully switched to offline learning, and these are some good news for parents, I'm guessing. But also offices are returning, companies are returning to offices. Now, as many companies are returning to offices, employees may feel anxious to go back to working in office spaces. So what should the employers be aware of at the moment?
Yes, I think that's a very interesting question because, and it will depend on every sector. Some sectors have the opportunity to provide sufficient office space and everybody can sit by themselves. Other in more crowded places, other have lots of frequent movement, etc. I think it's important that every employer thinks about what are their particular situations, what are the preventative measures that they can take in order to protect their staff. So over the past year and a half, we had to adjust to new realities. We had to adjust to an online working environment, and now there is a shift again to going back to work, going back to the offices. And one of the key recommendations is that the employers are attentive to the expectations of their employees, that they seek their advice, and that together they elaborate on the best solution that is fit or that suits their business particularly, because everybody has got their own particularities, and I think it's important that those are being taken into consideration. When we have certain colleagues that are anxious or that have a sick person at home or that have to handle work and family life at the same time and have not yet been able to set it all up because the past routines are not there anymore, I think it's good to just give them a bit of time, have a moment of adaptation, have a moment of flexibility, allow them to sort things out, and just progressively go back to a routine that we maybe had before or to a different way of working. So I think the message to all is just make sure that with your employers you seek for appropriate solutions that suits all in a way that people can adjust to the new current way of working and way of life, and just to make sure that we remain as safe as possible.
So the work-life balance as we knew it has been lost during this pandemic, and alarmingly more and more women have reported a desire to leave the workforce or to refuse a promotion because of the increased household roles during this pandemic. What would you say to these women?
I would say, first of all, a word of encouragement and a word of praise, because handling work and family care and the anxieties around it, the additional care that we had to provide for people that were sick, the additional fears that we had to deal with us falling sick or a family member falling sick, the measures that we had to take in order to make sure that everybody stays healthy or that everybody's looked after appropriately took a toll. And I think it's important to realize that it has affected, I believe, every woman as well as men. So I think it's important that we put a an emphasis on there's a responsibility on both. Men can support their wives to return back to the workforce. I truly believe that lots of Kazakh men are being wonderful husbands and wonderful fathers, and that they look after their families in an amazing way. And I think it's important to also emphasize that and all their efforts, but to just encourage women to explore ways on how they could envisage going back to the workforce. Maybe not right now, because things have not yet fallen into place the way they did in the past, but to find ways on how they can envisage at least returning back to it, or how they would be actually excited about the promotion. Please don't withhold yourself. Put yourself out there and things will fall into place. I trust that everyone will find their way.
Ms. Clarinval, thank you.
Thank you very much.